Good morning, afternoon, and evening to everyone. My name is Ed Perez. I'm the Global Sales Director at Nasco Healthcare. Today, we have an exciting webinar to introduce our latest product launch. XR Clinic is a virtual reality medical training solution that comes in two different configurations, mobile and desktop version. Our webinar will be structured in different sections. First, we will have a product introduction. This will be followed by a demonstration of the XR Clinic Mobile, the first version of the product. Then we will pause to answer your questions. The next step will be a demonstration of the XR Clinic Desktop version, and we will pause again for more questions. This will be followed by a demonstration of the case manager and a presentation of the Smart Center, and we will have a final round of questions. After that, we will summarize and wrap up everything. Please add your questions in the chat box anytime during the webinar. Also, this video will be recorded for later viewing. With that said, I'll pass the baton to Elena.
My name is Elena, and I'm representing Enver Company as a PR manager. And today, my colleague Paul will assist me with demonstration part of this presentation. Today, we're going to talk about our four products, two main products and two services, which we delivered to support our products, as Ed mentioned. And we are very excited and pleased to welcome you at this presentation. So our company focused on developing VR-based products to train students and medical personnel in a realistic simulation environment. Our two main products, XR Clinic Mobile and XR Clinic Desktop, are supported by our two web services, Case Manager and Smart Center. Fully immersive learning process helps learn faster and improve practical skills without any risk to real patient. Our product will be perfect for you if you work in medical schools, medical colleges, medical universities, or even hospitals. We would like to ensure you that our product does not require any consumables or spare parts, which means unlimited, valid for money, cost-effective use. Why we chose exactly VR area, VR technologies? In research from PricewaterhouseCoopers company, we decided that VR technologies is much effective, very affordable, user-friendly way to learn and practice different skills, such as technical skills or soft skills, as a leadership, communication, or even management. Statistics and a lot of testing and research show us that those who use VR technologies learn and training 4 times faster than in classrooms. They are 4 times more focused than their e-learners in the classrooms. VR learners for 275% more confident to apply their skills learned after training with VR products in real life with real patients than their e-learners after training in classrooms. These people 3 times more emotionally concentrated and involved in the learning process. We would like to tell you about our strong sides and unique selling points, which we have in our product and in our services. So first and main of this is a price, the lowest price in whole industry, as well as volume discount for package offers. For more details, you can contact your sales rep and ask any questions if you're interested in that. We offer a lifetime license for XR Clinic Mobile, as well as XR Clinic Desktop license, valid for 4 years. In our product, you will see most realistic, outstanding graphics, over 200 case scenarios available to work with in our library. The most unique feature which we have in our product is teleportation, which allows you to use our product with minimum space in your skill centers, in your universities. You literally can sit on a chair and use our product without any effective medical education process. We have a few languages at the moment, and minimum space, as I mentioned before, minimum space needed for our product use, and faster setup time and response. And we're very proud of our two services which we developed to support our two main products. And they will be very helpful and useful for teachers who want to create some educational process more interesting for their students, which is Case Manager and Smart Center. And now let's talk more about our first main product, XR Clinic Mobile. XR Clinic is a virtual reality-based product with a full immersive effect of simulation process. We developed this product to learn and practice required skills and knowledge needed in outpatient appointment. It is a very light and small product which you can take with you anywhere you're traveling, around your country, around the world, to demonstrate all these features. This simulator includes hardware and software. Hardware includes goggles, controllers, and carry case, as well as software, lifetime software license with 206 case scenarios, Case Manager for 12 months, which allows you to edit 206 scenarios and create your own unique 30 case scenarios within this 12 months, as well as Smart Center. And now I would like to ask my colleague Paul demonstrate our product in action with all features. Paul, please, over to you.
Thank you, Elena. Hello, everyone, ladies and gentlemen. My name is Paul, and I will guide you through the immersive journey with XR Clinic VR application. You will see yourself how beautiful is it and how easy to use it, because you can be as a doctor in an outpatient appointment yourself and use every practice that is common in outpatient appointment. We'll start our stream in just a second, and I will show you how it looks like. So you can see standard doctor's appointment room, and the first screen is settings screen, where you can enter your name, group, choose your gender and language. We have a few options available here. So you can use the exam option, which is scheduled by the teacher in a Smart Center. You can choose the tutorial option, which will guide you through basic mechanics of XR Clinic. And of course, you can go to cases, and that's what we're gonna do now. Now you will see the case selection menu. We have 10 disciplines, and every discipline has its own cases. Like you can choose one of that and choose one case that you'd like to go into. Now you see the case selection menu, and here we have a case tutorial option as well. It will guide you through all of the mechanics of a certain case and help you to be successful in it. Now we click the start option and the simulation begins. Now we'll see our room, and our patient is waiting behind the door, and the first thing we're going to do is hygiene. And this is a teleport function actually that we use inside the simulation. It is a unique solution that we provide with MVR. Here, it allows you to move inside the simulation and just stay in one spot in real life. So we can wash our hands, use the soap, sanitizer, paper towels. So the hygiene procedures are extremely important for our students to be taught with. And when we are ready, we teleport back to the table and invite our patient. Here he comes.
Hello, doctor.
You can mention that our patients are voiced with professional actors, and we start our examination with medical tools. We have few of them, and it's really easy to use. You just grab it and bring it to the patient, and it's going to be evaluated automatically. So we can check blood pressure, sugar, temperature, and oxygen. All the information will be stored in a history of disease window. This window is more analytical, so it stores all the information we have gained from the patient. And another window is irritational. And the first option is dialogue. We will ask some questions to our patient and save responses in different categories, such as complaints, analysis of life, analysis of disease, and epidemical analysis. It is important for a student to understand which category to choose for each response. Second option is clothing. We can address our patient to go further to physical examination options. Let us address him about the belt, and as soon as he comes back, palpation, percussion, and auscultation options will be available. Oh, here he comes, and you can see the purple arrows now, which are hints for areas to palpate. You will receive the vibrational feedback when you perform the palpation, and you see the result of it on the right side of the screen. Percussion is also available and really easy to do. You just put your left hand and right hand at top, and you hear the specific sound for every area when you percuss. To perform auscultation, we need to take a diaphragm from the table with a controller, hold it, and just pick it to the patient. You can hear the specific sound of every area that we auscultate, and if there is going to be some kind of pathology there, so the sound will be abnormal. We can perform auscultation in different positions, so we can change body positions in the menu and perform it from every side or from behind. Examination on the couch is also available. We choose the couch in the body position menu and will perform some palpation with our patient on a bed. I'll use a teleport function, which is really easy. And now we're going to palpate our patient, the iliac area. And when we palpate an area with a pathology, he reacts with voice and his body. So there is a hint for a student. He will understand that something's wrong in this area. And this is the area for us to concentrate with further assessments. And we can go further to assessments menu. Here we have additional examination options. We just choose as many as we wish, as many as needed, and send our patient to do that. While he's walking away for a couple of minutes, let's take a look at the history of disease window. It contains all the data about the patient, and the first option is a passport to see the common information about the patient. The dialog menu will provide us every response that we have saved from our patient. So the same categories will store every response, and we can analyze it and do more if we wish. So every option of examination is available by now. We can go back to a dialog or examination or anything it's needed. The review will store the information about physical examinations. You can see results of palpation, auscultation, percussion, and any medical tool that we use actually. So here a student can analyze it and do more if needed. We have full freedom of action in simulation action. And as soon as our patient had come, we can check the assessments that we have prescribed. Each of them has a picture and a conclusion, so you can work with it, and you can edit all the information in the special tool case manager. So you can upload pictures from a picture library and edit conclusions, or even upload your own X-ray if it's needed and use some real clinical data. which is amazing actually. As soon as we are ready, we can click on Finish the Examination button, and since that, no examination action will be available. Before that, we are free to use any option. We go further to the diagnosis menu, and there are a few options, and we can choose one of them. And we have also a treatment menu, which allows us to prescribe treatment with medications, hospitalization, diets. So we got a lot of options for every patient. We have the dosage, form, injection time for medicine. There's maybe variety for any case. As well, every option will be scored with the automatic evaluation system. So it depends a lot what the student does, what action he performs inside the simulation. And when we're in, so we go to the View Results button, and we will check our score now. Evaluation system provides us with score of every action performed. We see the common picture now, and we can go inside each category and take a look. What we see there, we see that every action was scored, and we have 3 types of grades: positive, negative, and neutral. Negative actions are missed actions. Yeah, that we should have performed that in the case, but we didn't. Also, excessive actions are negative. It's very important for us to learn students not to perform any excessives. So they will save the budget of a hospital and a clinic they're working with. Evaluation system is fully automated, and it takes no time to do that. So you get the results immediately. Basically, that's all about the VR simulation. And after all, I can say that it's really easy to use. Every student can deal with it. It is immersive and fascinating process. And I give the word back to Elena. Thank you for attention.
Thank you, Paul. We have a few questions, and let's answer. So first question, how many users can use at once?
The outpatient appointment means that the doctor is alone there, so you can be only one user inside a simulation, but we can use simultaneously as many as you wish. We have both VR and desktop version, and actually count of users is unlimited. So every session is unique, but you can launch as many sessions as you wish simultaneously.
Thank you, Paul. Second question, are the case scenarios customizable?
Yes, of course. That's one more feature that we have. We have a case manager web interface that allows you to customize current scenarios, which are more than 200 built in the XR Clinic app. And you also have an option to create your own scenarios. Change every data, every score, everything actually, and I will show you it later.
Thank you, Paul. Third question, while doing the VR session, can the class view it in a bigger screen for more further class evaluation and assessment?
Very nice question, thank you. Yes, you can do that. We have a special spectator function in the Smart Center, which allows the teacher to spectate, like real monitoring, make a real monitoring session while our student is inside the simulation. Other classmates can watch it on a big screen.
Thank you, Paul. We have the same question. Can we edit scenarios? I think we already answered. Yes, we can. Next question, how many VR gadgets can you connect into the case? Like, for example, 10 goggles within 10 students. Can they do the same one scenario?
Yes, sure. Of course they can. And even 20 or 30 goggles, no problem. They have the same case library and can work inside one scenario, but it will be individual experience for everyone.
Another question, how many types of patients do we have in our product? Adults, children?
We have different patients. We have both genders. We have only adults by now, but we are developing more. And we have different age, different bodies of a patient. So we try hard to make it variable.
Thank you, Paul. No more questions for now. So let's go to
Okay,
our
thank you.
next. Our next product is XR Clinic Desktop, which is very similar. Actually, it's the same product as XR Clinic Mobile, but have a few small difference. So XR Clinic Desktop is a product based on PC version, which is perfect for distant learning. Few difference between desktop and mobile version is that you don't need any hardware, any VR goggles, controllers, or anything else. But you do require PC or laptop, which doesn't include in a set. So it's just a license and software. Another difference is the teleportation feature. You don't have this feature in a desktop version because you don't need it. You will use your mouse to operate inside the session. And more about this, my colleague Paul will tell you. Paul, if you're ready.
Thank you. Yeah, of course. I will provide you like in a few minutes demo of a desktop version to show you that it has exactly the same functional and it's really easy to use. Moreover, our desktop version has really low system requirements. So it can be launched on any kind of a computer, laptop or PC. It doesn't require a video card. You can do it anywhere. So you can see the settings screen is exactly the same. So we have the tutorial options, cases, everything. We go further to the case selection menu. We have the same categories, same cases here available. Case tutorial is also available as well. And now we're gonna see the same room and the patient coming up. We have the hygiene options and everything is available by the click of a mouse. So we just click on the left corner and we go up to washing our hands, to hygiene, everything that we need. As soon as we're ready, we click to the left top corner to invite the patient. Every action is performed just with one click with your mouse easily. Now we can use medical tools. You just click on it and it will work automatically as easy as it is. We can also irritate with the patient and ask him questions, save our responses to same categories. We can address the patient as well. You can see functions are the same. And now we'll show you how palpation, percussion, auscultation looks like in the desktop version. We have the actions menu with this hand icon, and you just choose the examination you want to start and click on it. You see the same arrows. You adjust your mouse on the area you want to palpate and just click on it. Now you see the result of palpation of this area and it's going to be saved in the history of disease. Percussion is easy as it is. So you can see the same sound. And to start auscultation, you perform the same action. You can also change positions and move around the patient using these two buttons. So we can auscultate from here, for example. You can also use the same positions on the couch, standing, lying, or anywhere. And assessment menu is exactly the same. So we can choose some assessments and send our patient to perform it. And let's take a look on the history of disease window. It's on the left top corner as well. We just click on it. And we see exactly the same sections there. So the passport of the patient is main info, dialogue. So we have saved one question, one response into the complaints here. Review, so we can see we have performed some auscultation and palpation here. And assessments as well, exactly the same. So you can check the picture, you can check the conclusion and scroll here. So we finish examination when we are ready. Diagnosis options, we choose the right diagnosis, treatment, everything is exactly the same. And the evaluation system works well as well. So we can see the actions we have performed, actions that we have missed, and actions that were excessive or not. So the desktop version is really easy. It is compatible with all the Windows devices. It doesn't require any special hardware, can be launched in a university at the home place of the student, and it's perfect for distant learning. So basically that's all about the desktops, and we are ready to proceed to your questions.
Thank you, Paul. Yes, we do have a few questions. Let me tell you about this. So first question, are these cases good for multiple users that can role play all at once?
We already had same question before. So the outpatient appointment it is not designed for multiple users in one room. Can you imagine like 2 or 3 doctors in one room and outpatient? So it doesn't work as it. So as soon as we have these mechanics, so it is impossible to join in one room together, but you can work simultaneously with the same scenario in one room, in one classroom, or distantly. So the multiplayer is available actually, but it's going to be individual experience for every user.
Okay, thank you, Paul. And here's the next question. When do you see the infants and child patient being released? I think this is a question about pediatric patients.
Well, I'll answer that one. We don't have any timelines for that yet. We're working on it. As soon as it's ready, we will inform all our distribution network right away.
Next question. Where can we reach for another company demo and discuss procurement in case?
Okay, I'll get that one too. So please reach out to your local distributor in the country where you're based, otherwise to the Nasco regional sales director, which you can find on our website. Yeah, find the contacts.
Thank you, Ed. Next question. Can the class be done remotely? VR goggles with a school in the province, and VR desktop, the first product in another venue.
Yes, of course, it can be done remotely for sure, and we will show you a few use cases further. So initially, we provide the VR sessions. We mean it's going to be very well to use inside the classroom, but anyway, if students have headsets and their home place, it's going to be done as well distantly. But the desktop version is perfect for distant learning. As soon as we don't need anything by the PC, and it's compatible with every Windows devices, so it can be launched everywhere.
Thank you, Paul. Next question. Can we edit the scenarios for nursing students?
We can edit scenarios with the case manager tool, and you can actually design it in frames of the functional that we have. But we are now having outpatient appointment scenarios, and it is suitable for nurses in some variants. So yes, we can, but this one is more about doctors, not about nursing stuff, actually.
Thank you. Next question. How can we share results with other people?
Yeah, of course. You can, we have a smart center interface, and students will see its results inside the simulation. He can also have it on the mail, so you can receive it on the mail up to the end of the session. And we have a smart center, which is for a tutor, for a teacher, and it will store all the information about every session was performed in the XR Clinic desktop or VR, doesn't matter, it will be stored there, and the teacher can share it with anyone if it's needed.
Thank you. Next question. Does it work on non-Windows devices?
By now, we have it compatible only with Windows 10 and Windows 11, but we are working on the Mac version as well. So I believe in the future, it will be possible.
Next question, will the software updates automatically?
Yes, it is. So we have a full ecosystem. All the products are connected with each other. And when you start VR or desktop, the program will update cases. And if you made like new cases or some edits in the scenario, so it will be updated automatically. And the full update of the system will go automatically as well.
Okay, thanks, Paul. And last question, if there are any new scenarios available, will the scenarios will be provided at FOSS, since the license is for lifetime?
By now we have 206 scenarios, and actually this is like the biggest number of scenarios that is available on the market. Nobody provides that, but we are working on that, and I believe that it's going to be more and more. And moreover, you can customize your own scenarios, because every practice is unique in every university or medical school. So we have this case manager option that you can customize your own scenarios up to any kind of a standard you have. So we can help it with every manuals and everything.
Okay, and one more question. Can a teacher pause and interrupt a session on both mobile or desktop version products?
This functional, actually, we don't have it yet, but teacher can spectate and control the sessions, and if it's needed, so it can be interrupted as well, but we don't have like a pause button yet.
Okay, thank you, Paul. I think it's all for now. So summarizing everything what we was talking about, our products and how we can use it and what it does, we have a few use cases which people already using in their organizations and which we advising you to take a look at. So first case, use case, it's a mass training, group training of students or medical personnel with our VR or desktop version products with automated evaluation of studied material. So on the picture, you can see how teacher will spectate or real-time monitoring students who already using VR products, as you see, and using desktop version. And as you see in this picture, we mentioned before, our products have unique point is a teleportation, which allows you to sit on a chair and no space, no rooms, big rooms required. So it's very comfortable and very easy, simple to use. Second use case, it's a desktop version, basically, which is perfect for distant learning. And third use case, it's required for hospitals or medical centers. It allows hospitals to evaluate potential medical personnel, their knowledge and skills required in outpatient appointment, which is very helpful for hospitals and clinic when they're interested in any candidate. And now we go into our two web services, Case Manager and Smart Center, which was developed to support our two main products. Case Manager is a multifunctional and user-friendly platform where you can edit or create your own scenarios. This supportive service you can use to make your educational process even more realistic and interesting for your students and even yourself by creating absolutely unique case scenarios using your own experience from your life, from real patient cases. And here is a few points which Case Manager does and which you can use and present to your clients, which is voice over of dialogues in any languages with some of accents by using voice generator. So you don't need any more talk and speak and voice over it yourself, or even talk through microphone, like you can do this on some high fidelity products. You don't need to do this anymore. You can edit parameters of scoring system and score put scoring whatever you like. You can add your own images of ECG, MRI, X-ray, etc., which you see with real patient. You can use it, as well as uploading pathologists, heart and lung sounds. So you can create absolutely unique scenario by using your real life experience. And now, Paul, over to you. Show us what Case Manager can do.
Thank you, Elena. I think Case Manager is an amazing tool. And now let's take a look how it works. So the interface is really easy. You don't need any CAD dev skills. You can be just a simple user. It's designed very intuitive and available for anyone. So the first one is passport. So we can change this, how our patient looks like. We can change the work, age, or skin pathologies, visual pathologies if it's needed. The second is dialogue. This one is really fascinating because we can change answers of our patient to the question, and we can just type anything here, some kind of a text here, and we can voice it with one button. So we have few options for voicing, and we can use different accents. So if you need like Australian accent or Canada or Hong Kong or India, so we can choose it, and the text that you've typed here will be sounded, voiced automatically. So this is very useful if you need to customize your case and make it unique and with unique voice due to your region where you use it. We have also these score options that we can change for every action and a dialogue as well. So it can be 0 if it's not valuable, or it can be 10 or more if it's really valuable for us. Examination options are about percussion, auscultation, palpation, visual, and instrumental. So here we can change the interpretation of every action, and the score. Auscultation is exactly the same options, and palpation is really interesting because we have these pain options here, and the tick, if we move it from here, so this area will be painless. If we put it here, this area will be painful. So our patient will react on the palpation of this area. As you remember, we had in the VR simulation with the appendicite, so it will react with the voice and the body. It will see this area as a problem with pathology there. Visual examination and instruments are exactly the same functional, so we can change the interpretation of it and the score. Every action is scored. Additional examinations, we can choose any of it and change a picture if it's needed. So you can upload even your own X-ray here if you want to, and change the conclusion and the score as well. Diagnosis menu allows us to add any new diagnosis, delete any of them, and retype it if you need it, and of course choose the right diagnosis in a certain case. Treatment menu consists hospitalization options, diet options, so we can add more diets up to 3 simultaneously, and medicines for the pathology that we have in the case. Let's take a look that every piece of it can be evaluated. So you can evaluate even a dosage of a medicine if it's needed, if it matters a lot for educational process. I think that's great. You can control it absolutely. And moreover, we have a description for every case. You just type on this list icon, and so you can change, you can see every action here that should be performed in a certain case and the score for it. So this is very useful for a teacher and for a student as well. So they can train before they go into the case, into the exam mode, for example. We have also different languages performed here, and you can use the white theme or a dark theme as well. If it's nighttime or something, your eyes will feel more comfortable. So the case manager will allow you to perform different functions and to customize every piece of your case, make it as complicated as you wish. Change every score, every picture, every text, every sound if you need it. That's all about the case manager, and we are ready to go to your questions now.
Thank you, Paul. Yes, we have few questions. 1 second. Can we make a rectal or pelvic examination?
The rectal examination is not added yet, but we can go into the palpation of the abdomen, for example. So, and we are open for any kind of feedbacks because we are developing more and more our application, and we'll be glad if it values a lot. So we will probably add it in the application as well.
Thank you. Next question: should students have their own Oculus system? Could they download and use this app, I think our software, on their own system, or it is only paired with the MVR system?
We provide users with full cycle of a product. So both hardware and software, it should be used with the MVR system and will be customized for you for the XR clinic fully. So we do not provide it in the App Store. If you're talking about VR, it's going to be goggles and the software and every component that you need for it, external battery, etc., and everything.
Thank you. Next question: can this product be connected into mid or high fidelity mannequins?
This is not designed for mannequins actually, but we have a big practice with mannequins as well. So we have this practice done already, and we know that VR can work with mannequins. So, but not XR clinic by now.
Okay, thank you. And last question: can we use different language for voice in the scenarios?
Yes, of course. It works like that. The language that you're working with, if it's English, so it's going to provide you with voice in different English accents. If it's Spanish, it will provide you with different Spanish accents, and so on and so on. And we are working on languages, and we add new languages actually every month. So it's going to be more and more soon, and you can work on the language which is comfortable for you.
Okay, thank you, Paul. And let's go to our second supportive service, which we was talking about today, Smart Center. So Smart Center is a platform for complex administration of the whole educational process with different reports, videos, real-time session control. And this system provides you extensive statistic data of the full user or group of users educational process. Basically, you can track and see and analyze everything your students doing when they're using these products, mobile or desktop version. You can track or monitoring them in real time, as we said before, access to each simulator. And you can, all this summary data you can use to debrief success or all weaknesses and strong parts of your students, how they learning, is they good, is they not good, where is they make mistakes, or which part of educational process they good at. So all of this information will be saved and controlled in Smart Center. Both of our systems can be accessed by teacher from any computers or laptop. All you need is a link to our web service, your password and name. You don't need to be tied up to your actual working place. So you can use it at home if you're on a business trip, in different country, if you're traveling around the world, it doesn't matter. All you need is your password and link to access it. So basically you can set up examination, set up some tasks for students and follow their tasks and their results. And now thank you from our side, and I would like to pass words to Ed. Ed, please, over to you.
Yes, thanks, Elena. So we hope that you're finding all of this very useful. I'm just going to try and summarize everything. So we have launched this month of April our latest product, which is the XR Clinic solution. It's a medical training, or it's a virtual reality training medical solution, right? Which comes into different configurations. One is the mobile clinic, which is with the goggles. It's a full immersive solution where the students or anyone will feel is inside the scenario playing the doctor's role. The other one is the desktop solution, which is controlled by the mouse, right? It's not as immersive as the other one, but it follows the same structure. Those two products or configurations are supported by the case manager, which will allow you to control the 206 cases library, edit them, and also add another 30 cases of your choice if you want to create new ones, right? And then you have the Smart Center solution to monitor all the activity from the students which are working on it. Now, this is the slide we saw before, but it's really important, so let's highlight this again. The prices are the lowest in the industry. You won't find anything which is more competitive than our product. So it's really something that we are offering as a unique selling point for all of you. It's a lifetime license for the XR Clinic mobile. So once you buy the mobile, the goggles with the software, you worry no more about any licensing. You will get updates, and it's the license, it's forever. The desktop solution, it's a 4-year license. It's a very cheap solution you will find. And it's meant to be year 3 to year 6 of the medicine degree. So that's why it's 4 years, right? The leading graphics, we presented this already. I mean, we showcased this in a couple of shows this year. We got feedback. Some of you already have seen it. Your feedback was fantastic. The graphics are phenomenal. So basically, you've seen it now on the demonstration. So it is really a great solution graphics-wise. The case library, the biggest case library in the market right now. This is at the moment for medicine degrees. Every single oncology, surgery, cardiology, all the specialties you saw were for medicine. We will have future modules for other areas, which we will tell you about when the time comes. The teleportation, it's also unique. No one else offers this, which is fantastic. Once you try it, you will like it very much, which allows actually that you don't need to move in the scenario. You could just teleport anywhere. This is only for the mobile version, by the way. And then you can also move your joystick and go 360 degrees. So there's no, you can do the whole scenario without moving if you want. Multiple languages, like Elena said, right now, Spanish, English, Turkish, Arabic, and more coming very soon. Setup time takes 2 or 3 minutes to get started with the scenario, which is really good. Another good feature of this product. Space required, like I said, we say 4 square feet, but actually you don't need to move. So it's really, really nice in that sense. And then the case manager and the Smart Center to support both products. Really. We feel this is a fantastic product. We're very happy with it, and we will start presenting this to all of you in the future, and as we speak and as we start coming to visit you and do demonstrations. Once again, reach out to your distributors for more questions. If you have any questions right now, please, Elena, do we have something else that we can respond before we finish? Elena, are there any further questions?
We have some of them, actually.
Yes, we do have, sorry, my microphone was switched off. Yes, we do have a few questions. So first question, is it possible to create a case with a fixed action, no options, for the students to train standard procedure step by step?
Now we have full freedom for students, full action freedom, and that's like a philosophy of our simulator. So we teach them to the methodology. So not like step by step, but we try to teach them to think clinically, to think right, and to form the clinical reasoning. So this like another direction of studying. But we have received the feedbacks as well, and if you feel like to develop product more, maybe we will develop the version with like fixed steps. But by now, it's full freedom for a student. He's free to do whatever he should do, and the evaluation system will score every action.
Thank you. Another question: do we have any work related to psychiatry clinic?
No, not yet. It's not common for outpatient appointment, actually. So we have 10 disciplines performed there, and every discipline has like about from 5 to 10 or more cases. We can provide you with information. You can discuss it with your regional representative, so we can provide you with a full list of cases and the disciplines that we have.
Next question, privacy-wise, is a student name details mandatory?
If I understood right, that means that that you should enter the details of every student. For example, in VR, you can work two ways. You can be logged in or not. If you're logged in, every information is stored in the case in a smart center with your profile as a student, the student profile. You can also log just with your name and surname. And this is not mandatory actually, but it is needed for a teacher to work with information effectively. So if a teacher doesn't know what student held the session, so it will be hard to analyze for him. So it's not mandatory, but it's very useful for studying process to do that.
Thank you. How are cases stored? Can they be deleted? Can you manage access to live bit and stored cases?
Cases are stored in the case library, and it is common library for desktop and VR, both of them. You can work with it in the case manager. You can't delete cases like the 206 cases that are built in. But you can create more and more of your own cases and share it with your students through desktop and VR version.
Okay, I think we can add a bit more information about deleting cases. So if you would like to delete case, if you completely don't like the case, you can add this case in case manager and create basically recreate this case as you like. Is it correct, Paul?
Yeah, of course, you can customize as you wish. So you don't have to delete it. You can rebuild it, like fully rebuild it, and you will have absolutely another case in your library. That's true.
Okay, thank you. Quite a few questions here. It's really nice. After 4 years, we have to change the system or just update the software?
I see we are talking about the desktop version by now. So you have 4 years which your license will work, and in 6 months to generate licenses for your students. And after 4 years, you have to buy a new package, and so you can work with a new package and more and more. So 4 years is like more than enough according to our competitors, which provide like 1 month for subscription or 1 year for license, and it costs like 3 or 4 times more than our 4 years license. So we try our best to make it comfortable for our users.
Thank you. Next question. Are there any surgical cases available?
Yes, of course. We have more than 10 cases on surgery, and you can also get acquainted with it if you request it from your NHC representative.
Okay. Next question, where we can get the prices?
Please ask your distributor for prices. If you are a distributor, you should have received the prices on April 3rd. So ask your management about prices.
Thank you, Ed. Next question, is the memory expandable?
I think I need more details on that, because what memory do we mean actually? If you're talking about the case library, so they can be more than 200 cases. With the basic version, you can add 30 cases of your own. And if you need more options, so we have advanced versions of a case manager, which allows you to do more, twice more, 3 times more than you already have there. So case library is expandable for sure.
Okay, and last question, which is C, how long do results stay stored on the system after a student is finished?
It will be stored as long as your license works. So Smart Center will store every information, every station, every student which is registered in the system. And that's what it is used for. So as long as you use it, you'll have this information.
Okay, I can't see any more questions.
On behalf of Nasco Healthcare, many thanks for attending this presentation today. Should you have any further questions, please reach out to your regional sales directors and check our social media and website for further information. Thank you.